let me start. Well, actually, the environment is not so good to me because it's not so well equipped, and it's very difficult to sterilize the face. But please understand me. And then now I will apply POED and flow lift to this patient. So she already had a topical anesthetic solution. She's already applied topical anesthetic solution for 30 minutes, but she will feel some pain. So I will inject the dental lidocaine solution, which contains a little bit of epinephrine, which can contract the vessel. So as you know, the tissue around the forehead is really firm, and there's a rigid retaining ligament. It's very difficult to move the tissue upward. So I applied a very thick thread on the hairline toward the scalp. I usually applied 8 to 10 thread. I usually use Kogomest gear, which is the strongest one. And then it's not enough to lift the brow. I add some more thread, Kog Pro 3 or 2, because it's relatively thin. Because the thickness of forehead is not so thick, so if I use Kogomest gear, it's rare, but it can be thin. So that's why I applied Kog Pro 2 or 3. So I know that it's very difficult to memorize the name of mother. So what I mean, Kogomest gear means sculpted Kog, which is the thickest one. Then Kog Pro is cutting Kog. Usually the thickness is like 2 0. For Kogomest gear, it's 1 0. Okay. Then, as I said, it's not magic. I cannot lift her tissue with 1 or 2 thread. So I know that the situation in Greece, but we should apply enough numbers of thread. So can I start? First of all, I should inject more anesthetic solution, supratrochlear nerve. It's very painful. I shake the tissue to relieve the pain, but it's very painful. But block the supratrochlear and supraoptic is not enough because the other nerves are from lateral to the medial side, so you better inject more anesthetic solution along the eyebrow and lateral forehead. Painful? Sorry. You better shake your left hands when you inject the anesthetic solution. Could you decrease the volume a little bit? It can minimize the pain. I know it's very painful. And you also block the inserting point. Okay, then it requires around 10 minutes since the epinephrine works. It takes around 10 minutes because if I make a hole now, it bleeds much, as you know. Then I'd like to ask one thing. There's many doctors here, so I know that most of you are already using the thread. So, who do you usually use Kog thread here? Could you raise your hand? 1, 2, 3, 4, 5, 6, 7, 8, 9. But that's so common. So, which thread do you prefer? When you said you use Kog thread, who uses Kog thread? Raise your hands again. So, do you prefer mono thread or Kog thread? It depends, I know, but usually combine. Yes, that's a good idea because the purpose is different. Okay, so it seems that nowadays in Korea we usually use cold thread because it has more strength to correct the ptosis because it can physically pull the tissue. But before using the cold thread, I also have some fear to use it because I couldn't expect the result. But as you know, it's an observable thread. We can easily control the side effect, and there's a rare complication. So I recommend you use a cold thread easily. And if there's some complications like dimpling, just rubbing it or apply some RF, it's enough to correct it. So don't feel any fear to using the cold thread because it's very effective. And because it is loaded on the cannula type, so it makes less bruising or swelling. So patients even prefer. Okay? And then, okay, I will apply the thread. First of all, I should make a hole because this thread are loaded on cannula, not the sharp needle. So I cannot make a hole on skin with this cannula. So there can be bleeding because there's lots of vessels here. Okay. Press that, please. Okay. So if you have questions, feel free to ask it to me. I will apply the Cog Master gear, which has a sculpted cog on hairline first. Okay, can I check it? It's okay. Okay, so we are ready. So first of all, we should keep pulling the tissue with the left hand. This way. Okay, it's a little bit painful. So I insert the thread along the under the skin to the scalp. You may feel some resistance when you meet when the cannula tip meets the skin. Then I will apply that. Repeat. Okay. Is it painful? No? Okay. So the other side. Don't forget, keep pulling the tissue upward. The thread fixates the tissue, not pulling the tissue. So you should pull the thread by yourself with the left hand. Okay, so I inserted 8 Kogomaster gear on the hairline. Then I would remove the needle, keeping pulling the tissue. Okay. Then we can cut the residual tips. So at this point you can mildly pull the thread, not so strongly, because without this the tip of thread can be exposed. Okay, so because there's some dimpling around here, so you can correct it with the mild rubbing. But in this case, this area, hairline, is not so exposed where, so I will not correct the dimpling. It will dissolve in days. And that, as I said, I could find that there's some difference after inserting the thread. So there's a mild lifting of eyebrow, but we can find out a great difference. But I will add some more thread from the forehead to the eyebrow again, because the forehead has curvature. It's difficult to use a straight needle. So that's why I decrease the distance from the inserting point to the eyebrow. Okay? And then Pro 3, 8. Pro 3, 8. 빨리 주세요. Okay. Are there any questions? Okay, we can't correct the drooping of upper eyelid with this procedure. I can easily apply this procedure to the patient who has a short distance between the eyebrow and the eyelid margin. So we can widen the distance. 90 is okay. I usually apply 70 millimeter longs Pro 3, Pro 2, which has cannula. But in this case, we don't have Pro 2 here, so I will apply the Pro 3, which has 90 millimeter. But it's quite long, but you'd better to use a shorter one because the distance between the inserting point to the eyebrow is shorter than 7 cm. Okay. One by one. So the same maneuver, I will insert the needle on this point, but don't forget pulling the tissue first. But I'd like to make a pull a little bit higher. Okay, I apply the thread. Same way, first pulling the tissue tightly and insert the thread to the eyebrow and just twist 1 or 2 rounds. Then you may feel some resistance and then remove the thread this way. And I know you may feel some pain. It's okay. I will apply it on the lateral side. Okay, you may feel change of the position of the eyebrow. It's not so dramatic, but you can elevate it, you can pull the tissue around 5 millimeter to 1 cm with this insertion. Okay, and then cutting the residual tip, and then once you insert the needle, you can twist the needle, which helps the thread grasp the tissue surrounding. I know, it's simple. It's almost done. Okay. Scissors. Okay, I usually put a pillow under patient's shoulder to make their head upside down. Using the thread, we fix that kinds of natural appearance. I mean, when we bend her neck this way, so we just fix this appearance, because when she get up, there's a drooping due to the gravity. So do not overcorrect. It's okay. Okay. So it takes usually 5 minutes. So with mild sterilized condition, so I usually proceed this procedure in treatment room, not operation room. So okay, I already completed the forehead and eyebrow lift. Okay. Are there any questions about this procedure? Yes? Well, actually, you'd better to follow the muscle, or I usually insert the thread under the muscle, the frontalis.
And what about when you corrected the hairline? Where do you insert the needle there?
Sorry?
For the hairline, the one you did before, do you go under? Do you go? Which level
yes.
do you go there?
I mean, supraperiosteal layer.
Okay.
Okay. If you have any other question, okay, you. I can hear you. Sorry.
How long it lasts, this treatment?
We're actually,
the lift.
As I said, it's very around 3 minutes to 6 months, because the tissue is really difficult to lift up. So it's shorter than any other treatment on raw face. So as I said, it takes 3 months to 6 months.
Thank you.
You'd better consider the procedure in 7 to 6 months later. Okay? Yes, that's the end of the program. Do you have any other question about this procedure? Okay, use. Well, actually, you should consider many things. If you inject Botox, it's not lifting, it's a relaxation of frontalis muscle, so the height of eyebrow will go down a little bit. So you should consider the result first. But in my case, I usually inject the Botox very superficially, which cannot influence the height of eyebrow. Yeah. Sometimes I usually do the procedure with the Botox, but not so deep, superficially. Okay? And I usually inject the Botox on glabella to make a wrinkle on glabella, to lessen the wrinkle on glabella. So don't forget, if you inject it too deep, you will mimic the result of the thread lifting. Okay? Or there's another method using Botox. You may know that dermatoxin, through that method, we can lift a little bit, not so dominant, but you also use the dermatoxin method here. Do you usually use that? You just make a wheel under the dermis. So it's okay if you want to lift more, you can dilute the Botox on the dermal layer to make a dermatoxin method. Do you understand what I mean? Okay. Okay. I'd like to explain the dermatoxin method first. So I will explain it personally if you want. Okay.
Thank you. May I ask you also what you said to the patient to do after the treatment? What to do after the treatment?
Actually, I applied the patch to cover the inserting point, and then sometimes I apply the tape to conserve the result of the procedure, and then medication. As I said, do you remember that presentation? The painkiller like acetaminophen and paracetamol, which has least anti-inflammatory effect. There should be inflammation to get the result, and then I will give them some antibiotics. And no smoking, no alcohol, like that, right? Okay. If you have any other questions, I will complete this session. And then it takes time to prepare the second patient. I think that it takes about 10 minutes or more. Okay.